Today, it can feel like the healthcare system is not working for anyone. Clinicians deal with heavy workloads, limited resources, and long hours. Patients endure long waits to access services. Care isn't convenient or tailored to their needs. Healthcare organisations face rising demand, high staff turnover, and outdated and unreliable technology. These challenges impact the sustainability and the quality of our healthcare systems. Reimagining care delivery is crucial for staff well-being, patients, and the continuation of our health services. We must move towards more efficient, convenient, and scalable ways to deliver healthcare. A system designed around how we live and work today, which is convenient and efficient. An essential part of this is creating a way for clinicians to have full visibility of their patients' conditions without the need for them to visit a hospital for an appointment. Creating this visibility will enable clinicians to see how conditions develop and change over time through asynchronous information and intervene as soon as possible. This is why we started Isla. Applicable across any clinical speciality, Isla enables remote-first and self-supported care, cutting down on the need for face-to-face visits and offering healthcare that is accessible to all. Isla helps patients like Emma, who had a nasty fall which led to a major leg operation. Emma has been spending a lot of time resting in bed as her mobility is still very poor. On the days when she visits, Emma's nurse uses Isla to quickly and securely capture an image of the wound. This saves immediately to the medical record, but is also available to the clinicians whose input is needed. This continuous flow of data builds a clear picture of Emma's health for the multidisciplinary teams. Teams such as tissue viability, Emma's GP, and her podiatrist. With Emma's progress visible at all times, the clinical teams can keep an eye on Emma and decide on the best treatment for her. 4 weeks on, Emma is recovering well, but her nurse still wants to monitor her condition. Through Isla, Emma can regularly upload the photos of her wound for clinical review. She also manages her diabetes at home. Emma receives a secure link from her doctor. This lets her complete a short assessment form to keep him updated. With Isla, Emma can get the right treatment faster and without having to travel to her GP or wait for another nursing visit. She also feels reassured, knowing that any changes in her health are being monitored. It's not just patients like Emma whose experience and care can be improved with Isla. Sam can now manage his epilepsy from home by submitting videos of his seizures. This informs his medication and enables his clinical team to act sooner to help him manage his condition. Ruby, who recently had a C-section, regularly submits photos of the wound site so her clinical team can monitor for signs of infection and avoid the risk of her being readmitted. Dave feels relieved, knowing that the suspicious lump on his neck was seen within a couple of days instead of the 2-week wait period. The stories like Emma's, Sam's, Ruby's and Dave's are just a few examples from across the many specialities that Isla supports. For clinicians like Dr. Ahmed, who are supporting Emma and many other patients every day, Isla has transformed his workflow. For the first time ever, he has a complete view of patients' conditions remotely. He can now run highly automated pathways, which he's tailored to his practice, seamlessly collecting information in various formats, including videos, photos, forms, and sound recordings. He can access the platform from any device, such as his smartphone, tablet, and computers. He finds Isla easy to use, and the high patient response rates tell him that his patients love the platform too. Dr. Ahmed can now prioritize patients and assess risks more swiftly. With Isla's automated and scalable pathways, he can streamline patient data collection, reduce administrative burden, and save time. This helps him to move from reactive to proactive care. All this makes Dr. Ahmed more efficient and happy at work, knowing he can help more patients. He can now enjoy quality time with loved ones who've noticed a decrease in his work-related stress. Healthcare organisations across the NHS, Europe and North America already use Isla. The platform can be deployed across many clinical areas and delivers tangible results. 15% decrease in follow-up appointments, 3.8 times improvement in time to receive specialist input, significant reduction in surgery wait lists, helping 17,000 patients in just 9 months, 75% de-escalation of urgent wound care cases in community nursing, moving 15% of their workload to virtual care, and cutting down on travel and the use of resources supports the NHS Net Zero goals. Isla breaks down barriers by offering an easy-to-access solution with no need for software downloads, logins or sign-ups. Built with interoperability, security and ease of use as the foundations of the platform, it seamlessly links with existing workflows, systems and electronic patient records. But deploying technology alone will not drive sustainable change. It's the transformation of people and processes that's important too. That's why Isla is more than just a platform. It's your trusted technology partner and change consultant all in one. A partner that ensures your project delivers, giving you a product that through co-development grows with you as your clinical and operational needs grow. Curious to see how Isla could transform your healthcare delivery? Let's chat to discuss insightful case studies and to show you how it works.